Dr. Allan Grill is Chief of Family Medicine at the hospital in Markham-Stouffville outside of Toronto in Ontario. Dr. Grill, always good to see you. Surprised or not by these numbers, and what's the takeaway?
So I'm not surprised at all. And in fact, these numbers are not good. The High study is showing that there are several million people across Canada that don't have access to a family physician. We can also include other primary care providers in there, like nurse practitioners. And this is something that not should be the standard that Canadians expect. In fact, it's quite embarrassing. You know, having a family physician shouldn't be a luxury, it should be a right. And can you imagine if public schools told children living across Canada that there wasn't room for them and they couldn't get an education? Like, it's absolutely a ridiculous thought. And I think that there's two main issues that we have to talk about with regards to this data. One is, what are the unintended consequences for patients who don't have a family physician? And number two, how are we going to solve some of the health system challenges that are being faced by family physicians so we can not only help retain them in the profession, but we can continue to recruit more medical students and residents to go into family medicine?
Yeah, what's the issue with that? Why, grads are not interested, or less interested, perhaps, is a better way to put it, Dr. Grill, of going into family medicine?
So I think what's happening is there are health system challenges faced by family physicians across Canada. You know, I speak to my colleagues in many different provinces, and a lot of them are facing the same thing. So number one, there's a huge administrative burden on family physicians. So there was a study that was done that shows, on average, most family physicians are spending 19 hours a week on things like paperwork, filling out forms, sick notes for patients because their employer needs them to get a note before they go back to work, chasing down referrals to specialists when sometimes they get rejected. And, that's almost 2 days a week. And that's outside of sitting in front of a patient providing care. When I was in training, we were trained to look after people and to help them. That's what we love to do. Spending all this extra hours on paperwork is a big problem. And that's one of, I think, the reasons why in the High study, a lot of people had trouble with same-day appointments. How can you get into your doctor on the same day when they're doing 19 hours of paperwork? It's hard to offer everything. Number two, there isn't enough team-based care. So, you have some solo docs that are working really hard just to manage their practice. And then you have other practices like mine, where I've got social workers and I've got dietitians to help carry the load and offer an urgent care service, right? So we can see our patients in the evenings and on the weekends so they don't end up in emerge, which is another thing the paper showed. And then finally, the cost of running an office, just like in other professions, is going up. Staffing, supplies, rent, and our income has not sort of gone up with the cost of expenses based on most provincial agreements with government. So I think those are three major challenges facing recruitment and retention in family medicine.
Dr. Grill, always good to have you part of our coverage today. Thank you for coming on CTV and giving us your thoughts on this one and this survey.
My pleasure.